Hello, my name is Laura Garces and I'm going to talk about is gastrointestinal complication of granulomatosis with polyangiitis. First definition. Granulomatosis with polyangiitis is a multisystem disease that is part of the small B-cell vasculitis associated with antibodies against the cytoplasm of neutrophils along with eosinophilic granulomatosis with polyangiitis. Microscopic polyangiitis and ANCA associated vasculitis limit to an organ.
Granulomatosis with polyangiitis, previously known as Wegener's granulomatosis, is a rare disease. It is a type of vasculitis, or inflammation of the blood vessels, and the inflammation limits the flow of blood to important organs, causing damage. It can affect any organ, but it mainly affects the sinuses, nose, trachea, windpipe, lungs, and kidneys. The cause of this health condition is unknown. It can affect people at any age, and men and women are equally affected. It is more common in whites, and symptoms may include joint pain, weakness, tiredness, and cold symptoms such as a runny nose that does not get better. Doctors use blood tests, chest x-rays, and biopsies to diagnose GPA and rule out other causes of the symptoms. Early treatment is important, and most people improve with medicines to slow or stop the inflammation.
Application in medicine. The cause of this disease is unknown. It can affect people of any age. Men and women suffer it equally. It is more common in Caucasians. Symptoms can include joint pain, weakness, tiredness, and flu-like symptoms such as a runny nose that doesn't improve. Doctors use blood tests, chest x-rays, and biopsies to diagnose the disease and rule out other causes based on symptoms.
Okay, we are back, and we're going to continue with our path bites. Listening to a little bit of music in the background. So, let's talk about granulomatosis with polyangiitis. Granulomatosis with polyangiitis is the new and proper name for a disease previously called Wegener granulomatosis. Wegener granulomatosis was the accepted name for this disease for many years, even though the physician who named the disorder, Dr. Friedrich Wegener, was known to have been a member of the Nazi Party. In the 1930s, it was apparently not uncommon for physicians to join the Nazi Party simply to keep their positions at universities and hospitals. So perhaps keeping Wegener's name in the disease isn't so surprising. In fact, Wegener was awarded the title of Master Clinician by the American College of Chest Physicians in 1989, and the title has since been rescinded. Things changed in 2011 when a doctor at the Mayo Clinic in my home state of Minnesota delved a little deeper into Wegener's life and found evidence that Wegener's membership in the Nazi Party was not just a name-only kind of thing. He also was a member of the Sturmabteilung, also known as the Brown Shirts, which terrorized Hitler's opponents. There's other very unpleasant stuff too that we don't need to go into. So all the major medical organizations have renounced the name Wegener granulomatosis, and now granulomatosis with polyangiitis is the official name. It's even in Robbins, so that seals it up. Granulomatosis with polyangiitis is a necrotizing vasculitis characterized by a triad of findings. First, acute necrotizing granulomas of the respiratory tract. Next, vasculitis of small to medium-sized vessels, especially in lungs, and glomerulonephritis. It's probably caused by some kind of T-cell mediated hypersensitivity reaction to some inhaled infections or environmental agent, but nobody is sure what that agent is. Finally, PR3 ANCAs, also known as C ANCAs, are present in almost all patients. ANCA stands for anti-neutrophil cytoplasmic antibody. We'll talk more about ANCAs on Wednesday, but for now, just know that it's not uncommon for patients with vasculitis to have antibodies against antigens in the cytoplasm of neutrophils. I know, it's super weird. In granulomatosis with polyangiitis, you can follow these antibodies to see how well patients are responding to treatment. If you're hungry for more, please go to Robbins' 9th edition, page 511. Sunny day here in Tokyo. Thanks for tuning in.
Pros and cons. Pros. In recent time, more than 18% of patients who are treated are alive at least for 8 to 9 years. With advance in treatment, they have a higher long-term survival rate and have been able to lead a relative normal life. Cons. Living with granulomatosis with polyangiitis can be very challenging. Fatigue, pain, complication of the disease.
My name is Dr. Les Mertz, and I'm a rheumatologist at the Mayo Clinic in Arizona. I would like to tell you about an autoimmune disorder called ANCA-positive vasculitis and a new study that the Mayo Clinic is participating in at this time. Most of you already know something about the immune system. When the immune system functions normally, it helps to fight off viruses, bacteria, and cancer cells. When the immune system functions abnormally, you may develop unusual infections or damage to the normal cells and tissues of your body. Autoimmune disorders develop in such circumstances, and you already likely know about some of them, including rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, scleroderma, and vasculitis. One of the most common types of vasculitis is ANCA-positive vasculitis. ANCA stands for anti-neutrophil cytoplasmic antibody and represents the antibody that can be found in your blood when you have one of these conditions. There are actually 3 of these, including granulomatosis with polyangiitis, previously called Wegener's granulomatosis, microscopic polyangiitis, and eosinophilic granulomatosis and polyangiitis, previously called Churg-Strauss granulomatosis. If you have granulomatosis with polyangiitis or microscopic polyangiitis, your doctor will likely prescribe medications that suppress the immune system to reduce the inflammatory damage that may occur to your tissues and organs. These medications may suppress the immune system enough that you will actually develop an infection or be at increased risk of developing a cancer. In April of 2001, the FDA approved a new treatment for granulomatosis with polyangiitis and microscopic polyangiitis. Since it is a relatively new treatment, the pharmaceutical company is sponsoring a study to help determine even further the benefits and side effects of this new treatment being used for treating patients with ANCA-positive vasculitis. Our 3 Mayo Clinic campuses in Arizona, Florida, and Rochester are participating in these studies, and you might be a candidate to participate in them if you have granulomatosis with polyangiitis or microscopic polyangiitis. You may review the details.
Easy applied in Ecuador. The most common diagnosis method for Wegener's granulomatosis in Ecuador is by determination of antineutrophil cytoplasmic antibodies, but possibility is not conclusive and negative ANCAS are not sufficient to reject the diagnostic. Conclusion. Wegener's disease is unknown cause out bacteria and viruses, as well as genetics have been implicated in its pathogenicity if it's not treated. In time, it can complicate vital organs and not perform their function properly. However, there are many pharmacological treatments that help control the symptoms and prevent the disease from progressing and also improve the quality of life of the patient. Thank you.